Let's go see if there are any other like-minded others. Hi, my name is Debbie Burrell, and I have been a long-time holder of a Blue Cross policy. This is my experience with Blue Cross. Just be happy that if you're healthy. And luckily, I am mostly healthy. Do yoga, do qigong, do I get any benefits for that? No. What I get are my rates raised this year exorbitantly, like maybe 30%. Yeah.
Well, it's interesting that so many other parts of the world have it and we don't.
Yeah, what's up with that?
Well, I think part of it is that they tend to try to operate a more regulated capitalism than we do. Over the years since the deal, there were too many good things. The people that are opposed to the common run of the people having things, or who are in favor of their version of capitalism, have been very successful. And they made a lot of money, and they put a lot of money into politics. And so they've been able to have a big influence over state legislatures and over the federal government.
Boy, that's for sure.
And so it's made a huge change in what the regulatory situation is.
And only need two things. I need to get a small technique at my ear doctor, which they won't pay for, and one medicine, which they will no longer pay for. Other than that, I do yoga, I do qigong, I never go to the emergency room, I rarely go to the doctors, but they won't pay for the things that I need. And I'm one of the lucky ones. That's all I have to say about Blue Cross and Blue Shield.
Blue Cross Blue Shield is a bunch of blood-sucking parasites. They are not interested in helping people with medical problems, long or short-term, or anything having to do with health care. They're in the business of sick care, and that makes me angry.
Yeah. You're one of the early members of MoKan, aren't you?
Yeah. Yeah.
MoKan stands for?
Well, Medicare for all, MoKan.
Okay.
Right.
Medicare for all, right on, Medicare for all, rolling down the highway. Here we go, America, get with it.
Get a pair of Heelys.
Oh, that's good, okay. Yeah, maybe we can try to get arrested here. Okay.
A fundamental shift is occurring in our healthcare system. There's a paradigm change that's occurring, and we're providing fundamental rights for individuals similar to other rights that we take for granted, like educating our kids or having clean water or streets and systems. Yes, healthcare is a fundamental need, and today corporate marketplaces as well as neighborhoods are focusing on wellness and the idea that we can collectively, through knowledge, provide the insight that human beings need for basic health needs. Although this facility, which is being pioneered by an organization that is basically obsolete for today's healthcare needs. At the headquarters of Blue Cross and Blue Shield, an organization that understands that the employees are healthy the costs are lower. And we should use them as a model, as the benefits that they've been able to provide their employees through the excessive $20 billion worth of gains that the insurance industry has realized over the last calendar year.
Right on.
That it can change, it's fundamentally changing, and the seeds are being put into place from an unstoppable urge to be able to provide basic human needs.
Okay, move over. No, I mean, I gotta get the sign. There we go.
Profession that provides the care. Somehow the insurance company is the in-between guy, and the really realistic, they're just ripping us off in the manner of parasites to get a big share out of it. And very easily could the management of healthcare be taken care of in let's call it in a social organization like Medicare.
Right on.
That they could, I dare say, do fully as well, if not better,
Right on.
and a lot cheaper.
Yeah. Our contact point is here, and we advocate for a single payer system.
Oh, okay.
Which people, by the way, anybody who's in an insurance industry or a private provider of insurance or something like that, the first reemployment of people would be those individuals who work for existing companies, because any system's going to need the exact same skills to adjust and switch between people. The clerks,
the person on my floor that would agree with you completely. So.
Liberty for all. Healthcare for all. Education for all. Oh wait, we can't be talking about America. We must be talking about someplace else.